Dr. Chandrashekhar Kale is a pediatric ophthalmologist and a squint specialist. After completing his masters from St. G.S. Medical College and KM Hospital, Mumbai, he went for fellowship in this specialty at Narayan Netralaya, Bangalore. He has had intense training and a vast experience of 9 years, wherein he has examined more than 10,000 children, which includes infants or babies which are 3 to 4 weeks old. And he has performed lot number of surgeries also. His special interests are complicated squint surgeries and pediatric cataract. So let us hear Dr. Kale about his branch.
Doctor, what is pediatric ophthalmology and how is it different from general ophthalmology?
Pediatric ophthalmology is a super specialty branch of ophthalmology which deals with all the eye diseases of the children.
Okay.
A child's eye is completely different from an adult's eye, both structurally as well as functionally. There are many diseases which needs to be treated in early childhood life so that they don't pose a problem later on. Also, the examination in a child is completely different from an examination in an adult. So just to give an example, if I have to check a power for an adult patient, I just simply ask the patient to read what the letters he sees on the chart and give him the number. Whereas in a child, it's not possible. Say for a 2 or 3 year old child who doesn't read, or even for a matter of 5 or 6 year old child who can read, but sometimes he strains his eyes to read, and therefore we cannot get an accurate number. So what we do in children is we put some drops in the eyes so as to relax their eye muscles and then check the number objectively with a machine procedure called as a retinoscopy. Now, pediatric ophthalmologists are trained in this procedure extensively during their fellowship training. We take pride here in informing you that we have done refractions in thousands of children from 3 months of age to 16 years of age and have given them glasses at the earliest so that their visual development has not been hampered.
So, doctor, there's a parent who has a child who has a number of -3 DS, and in the past 2 years, the number is constantly increasing. So, the parent is very worried, and they want to ask if there are any measures to decrease the number.
First of all, I'd like to inform you that there is no such medical treatment which is available to decrease the power of the glass. Okay. The child has got as a myopia, what we call as short-sightedness. Okay. So in this condition, the number is going to increase as per his body growth and body height. And this will go on till 16 years of age, 16 to 18 years of age. The other factor which causes increase in number is eye strain and less of outdoor activities. So nowadays most of the children are glued to the mobile phones. So there are many studies which are available which says that outdoor activities decreases the progression of myopia. Having said so, a new drug has been launched which effectively decreases the progression of myopia. Okay, this is a very safe drug, but it has to be started only under consideration from your local pediatric ophthalmologist.
So, doctor, there's a parent who has a son of 5 years and he has been squinting his eyes and he was advised surgery. So, they are concerned whether they should wait till the child is older for surgery.
See, there are two aspects for squint surgery. One is the functional and the second is the cosmetic part. When we talk about squint surgery or vision improvement, we always talk about 3-dimension vision, that is a stereo vision. Now this vision is deficit in a child who has a squint of the eyes. A visual plasticity of a person is till 8 years of age. That means we can improve a vision of a child till 8 years of age. Okay, so if a surgery is indicated, it's always better to do the surgery at the earliest. After 8 years, you can still do a squint surgery, but your 3-dimension vision will not improve then.
Can you explain squint surgery? How is it done? Is it laser?
Squint surgery is not a laser surgery. It's an actual surgery involving alteration of muscle forces and use of sutures. Okay. However, the sutures are very fine and we cannot see the sutures. The sutures get absorbed on its own. Surgery in children is done under general anesthesia, but with the advances in anesthesia management, the surgery has become very safe. The child will have some discomfort for 1 or 2 days and can resume his school in 4 to 5 days.
So, doctor, there are parents who do not have any eye problems and they have children of suppose 5 years of age. So, they want to know if they should get their child's eye checked.
Yes, they should get the eyes checked because mild refractive errors or unilateral refractive errors pass unnoticed if they are not checked. If a child has got a power in one eye and the other eye is good, the child will not have a visual problem because he's seeing from both the eyes together. But actually the child is seeing only from the one eye. So it's very important that the child needs to get his eye checkup done. What we recommend is that every child between 3 to 4 years of age has to get a detailed eye evaluation done.
So, doctor, a parent is concerned that despite wearing glasses, the child is not able to see properly and he's been diagnosed with lazy eye. So, can you tell us a bit about lazy eye and what is it? How can it be prevented?
Lazy eye is a condition where the vision in one eye is poor in spite of wearing glasses. So, the child sees mainly with the help of one eye. Now, to understand the lazy eye, we need to know the physiology of vision. So when a ray of light falls from the object on the retina, you see an image on the retina. Now if the eyes are normal with no glass numbers, then the image is very clear. Now these two images are now transferred to the brain with the help of optic nerves. And brain receives two images from each eye. Now if these images are same in size, clarity, contrast, then the brain will fuse these two images and you see one image. So in spite of having two eyes, we always see one image. What happens in lazy eye is one eye has got a high number, so the image from that eye is very blurred because the child is not wearing glasses. The other eye has got a good clear image. So these two images when are transferred to the brain receives a clear image from the good eye and a blur image from the poor eye. So these two images cannot be fused. So there is a confusion at the level of brain as to which image the brain has to follow. So the brain then suppresses one image and obviously the brain will suppress the poor image. That means the brain will see from the eye which shows him the clear image. So if this is not treated, the brain gets used to it or gets habituated to see from the good eye and the vision from the poor eye gets dropped down. So this is a lazy eye. Now treatment for lazy eye involves treatment of the cause. So if the child has got a number, he needs to wear glasses. If he has got a squint, he needs to be operated for the squint. Okay. But just correcting the cause will not solve the problem because now your brain has now got used to see from the good eye. So we need to force the brain to see from the eye which has got a poor vision. Now this is possible when you close the good eye. This is called as a patching treatment. So the principle is to close the good eye so that the child sees from the eye which has got a poor vision. Now this is done 2 to 6 hours in a day depending upon vision of the eye. So this stimulates the brain and gradually the vision improves during this period. Ideally this exercise has to be done before 8 years of age to achieve some visual improvement.
So if a child has recurring redness and itching of eyes, so if we put eye drops, the itching subsides. But when he stops the medicine, it recurs back. So what do you advise for it?
Okay, this child suffers from allergic conjunctivitis or simple terms a dust allergy. Because of the type of climate we stay, many children are prone for dust allergies and there is no permanent solution for this. This will recur. Sometimes it recurs once in a year, sometimes it recurs every 3 to 4 months. Whenever there is change of climate, the child will have these things. So medicines do play a role in controlling the allergy, but what is more important is the ocular hygiene part. The child has a severe itching, so he keeps on rubbing his eyes. So this is strictly prohibited because the hands are dirty, we just rub the eyes and we actually aggravate the allergy part. So whenever there is a severe itching in the eyes, we recommend that the mother or the child take an ice cube, wrap that in a handkerchief and apply the ice over his closed eye. So that will decrease the itching part. Whenever the child comes home from outside, he will wash his hands with soap and water, he will wash his face with water. So that decreases the allergy component. As far as the symptomatic relief, we start on some eye drops, which includes steroid eye drops, anti-allergic eye drops and lubricating eye drops. Of this, the steroid eye drops are known for complications. So it's very important for the parents to understand that once the child is on treatment, they have to follow up with the doctor regularly.
So what tips would you like to give to us to maintain a good eye, and especially would you like to advise something for the children as well?
Yes. See, eyes are one of the most delicate part of a human body. So we have to take a proper care of the eyes. Okay. Nowadays, the most common problem which the parents face is that every child is almost glued to a mobile gadget. So this definitely is taking toll on the child's health as well as the eye. And there are increased incidences of glass numbers, eye strain, headache. So ideally, a screen time limitation has to be followed. What we recommend is not more than 1 to 1.5 hours in a day, which includes all the gadgets like TV, mobile, iPads, etc. Your diet should have more of green vegetables, carrot, papaya, beetroot. So all vitamin A rich things are recommended. Whenever a child comes home from outside, he should wash his hands with soap and water. He should wash his face with water. Okay. While reading, he should see that the light is adequate. You should not sleep and read. Also, reading in a moving car or moving bus is prohibited. If the child has got a glass number, he has to wear the glasses constantly throughout the day.